Hello, my name is Dr. Bobby Sura. I'm a consultant psychologist and director at Solihull Wellbeing Clinic. Really privileged today to be joined by Roland Baskerville. Roland is a Bowen therapist. He's been trained in this since 2013, where he qualified. He's also trained in sports massage and is a sports trainer. He's worked with some really famous musicians over the years, so today, he's going to be sharing a little bit of insight into the services he offers at Solihull Wellbeing Clinic and the kinds of things that he treats. So, without further ado, I'm going to say hello to Roland. So, Roland,
Uh,
hi.
Hi, Dr. Bobby. Thanks for having me here today. I'm looking forward to just sharing a bit of knowledge and about the work that I do. Thanks for giving me this opportunity.
That's wonderful. Thank you for taking the time, Roland. So, Roland, you qualified back in 2013, you were saying?
Yeah, I started off as a therapist from around 2003. So
Yes,
initially, I did a intensive personal training diploma,
yes.
and sort of about a third of that was sports therapy. So I started body work from then,
Okay.
and then somebody fixed my back with Bowen Therapy in sort of late 2000s, and it really amazed me. And then it was years later I thought I'd like to train in something else or add something onto my therapy practice, and I thought, well, that worked for me, so I trained in Bowen as well from there, so I added it on to what I was already doing. Yeah.
Lovely. So that's a bit about your background and Bowen. Tell me a bit about Bowen then. Where does the name come from?
It was developed by a guy called Tom Bowen, who was an Australian guy, and he used to train in studied a lot of traditional Chinese medicine, shiatsu, so he was quite versed in those techniques. And then came up with this rolling, popping type movement. It was what Tom added to the therapy world in a way. It was a new way of affecting the body, a gentle rolling type movement.
Mhm,
And he found that it had quite a dramatic effect on helping the body to adjust and to heal itself.
mhm.
So he developed the technique, but it was having such a positive effect. I mean, he was treating about 13,000 people a year at one point because he used to have 3 or 4 rooms on the go because there's rest periods with Boeing. So he'd treat one person and then treat another person while they were resting.
Mhm.
And at first he didn't charge anything. And then it was the people he treated encouraged him to start charging and also to start teaching the technique.
Mm.
I suppose it's just spread from there and then eventually appeared in my life as someone coming over and helping my back in a gym. Didn't know what they were doing or what it was.
Mm.
But it's interesting how these techniques can just spread all over the world and then just come into your life at a certain point, a certain place.
So having
Um,
had that treatment, you later realize it was Bowen therapy. So
yeah,
it's
I did.
yeah.
Sorry, yes, that's right. I mean, I pulled my back in the gym. I was in a lot of pain. A lady came over and she just said, "Do you want some help?" And I said, "Yeah, just whatever." And she said, "Well, just put your hands against the wall." Put my hands against the wall, and then she did these very gentle moves up
Mhm.
my back, and the pain dropped by like 80% on the spot.
Straight
And I
away
did,
with short treatments like that.
yeah, I
Yeah.
didn't realize that's something that people could do up to that point. I didn't
Mhm.
realize that I'd known about drugs and ibuprofen and physiotherapy, but I didn't know that someone could do these tiny little touches and rolls and pops, and then the pain would just go. I
Mm.
was just almost couldn't believe it. And then
Mm.
it was years later that I realized that I want to train in that as well.
Yes, yes.
So
So it's not like it's definitely a hands-on treatment, but it's not
yes,
like a deep tissue or a kind of knuckles in your back. It's very gentle rolling movements, you're saying.
that's
Uh,
right. Yes. So
yeah, it's amazing. How does that work? I mean, what does it do to
oh, well, that's
the
very big. Yeah, interesting question. So um, your body has receptors, like big bunches of receptors, almost like ears, if you like, that listen to what's going on at each area. So I don't know if you've ever seen the special effects where they have a green screen background and someone wears a mapping suit that has all
Yes.
the dots on all the moving parts
Yeah.
so that the computer can build a model of the movement.
Hmm.
So your nervous system also has a similar thing where it has nodes on all the moving parts so it can sort of control the shape and form of the body, control how much tension is in the muscles, control the balance as we're affected by gravity.
Uh-huh.
So on it can work on multiple different ways, but I guess a simple explanation would be that when we like affect these points, these nodes,
Hmm.
and give them a nudge, if you like,
Hmm.
with Bowen, it's a rolling movement. Acupuncturists might use a needle. Some
Yes.
other people might use heat. Some people might use tapping. Some people might use vibration. So different therapists might affect those same points. We all work on those same points, but we might have different ways that we affect them. And by stimulating those points, it can encourage the body to, I guess, go into a deeper assessment of itself
Mm.
or to kind of encourage the body's own automatic regulatory systems to work, a bit better. So someone might have had a car accident years ago, or maybe they always sit on the one side on their desk every day while they drink the coffee or look at the phone. And
Mm.
eventually the body can get pushed out of position. And then it thinks that this is a new straight. And it just gets used to it.
I see.
And when you touch the correct points that are all related to that,
Hmm.
it's like the body just goes, oh, yeah, that's not the right position. And it just changes itself.
So it's like a self-healing sort of mechanism.
It's,
Like the body knows best and just
yeah,
forgets how it was, kind of thing.
absolutely. I
Yeah.
think luckily, we've always got, I guess, like a blueprint in us that the body knows its best. It knows its best balance. It knows what's best for itself.
Hmm.
It can just be kind of convinced that it can be manipulated into being off center. Could be
Mm.
a poor diet, could be the way we work, stress levels.
Right.
But by affecting these auto regulation points and causing the body to go into a kind of reset, I guess, the body just goes, oh, yeah, I'm not in the right position. And then it just makes its adjustment itself.
Mm.
That could happen with muscle tension. It can happen with stress. If people are highly strong, then sometimes the body just relaxes and there's a release. Sometimes
Yes.
people get an emotional release. Sometimes that happens.
Right. Right. So it goes beyond a sense of physical calm and a physical comfort to all sort of, I suppose the body and mind is connected, isn't it? So that
Absolutely.
emotional
Well,
comfort comes as well. Mm.
if we carry ourselves in, like, say we're like depressed, we might roll our shoulders forward, maybe we hang our head low,
Yes.
maybe we just have a withdrawn kind of posture. What
Yeah.
the body's doing is a totem to
Mm.
what's going on in our emotional aspect. So sometimes when you hit the points that are making the body that shape, and then
Yes.
the body comes out of that shape, there has to be some kind of relationship to our emotions as well. So,
Yes.
say if someone's very hunched over and it's maybe a slight trauma response, if all of that relaxes and
Yes.
maybe the shoulders come back a bit and the muscles soften, someone may experience something might come up
Hmm.
that holding was linked to.
Wow. That's amazing. And would you ever get into any conversation around that, or would it be a kind of non-verbal exchange, an experience that you and the patient are having?
Well, it's important, I think, that I make people aware that that's a possibility, a possible outcome of the treatment, so that we can sort of set the scene, and also let them know it's a safe space that if something does come up, that's okay, because sometimes I think we might feel a bit shy or feel like, oh, actually I want to cry or actually I've got some stuff arising, and I sort of
Wow.
make that clear that that could be a possibility. It might come after, but maybe it could happen during the treatment, and that's all right.
Wow. That's
Um,
really profound. So people are learning about themselves in various ways, not only getting relief from pain and discomfort, but perhaps it's opening up areas of further inquiry for them. And would Roland, would you go further into that, or would that be a sort of domain of a different kind of professional, would you say?
Yeah,
Um,
I mean, I sort of you can as a holistic, if you work holistically, you can never just do Bowen, but it's about being someone who can sort of be there for people in different ways is important. So I'm not a psychotherapist or a counselor,
yeah,
but I'll listen or I'll give people that space, and
yes,
then I will, refer on
yeah,
where appropriate. Sometimes I'll be it sounds like something's come up. It might be good to talk to someone to help, process that more deeply. So that's when I'd refer on to someone like yourself,
mm,
or because the physical release I think, can help to open up um, a process of understanding or processing or releasing. It might not just be Bowen that can do it on its own, but it can help.
of
If
course.
your person is relaxed and feels released and stuff's coming up that they're holding down, they could come and speak to someone like yourself to then
Yeah,
work through it and maybe come to a new understanding.
yeah. No, I mean, there's this whole sort of philosophy of trauma and how the body keeps the score. That nothing is lost on us. We if we're not processing it emotionally, or we can't sort of move through it, it sort of resides within the body and the mind in some way. So I think unlocking that and people feeling something, it's wonderful. And the fact that you're in a clinic like this, Roland, at Solihull Wellbeing Clinic, where there are these different kinds of service, it's quite good, isn't it, to be able to offer something that would complement what you're doing and vice versa. So, Roland, there's a real life example. My sister-in-law a few days ago had a kind of an issue where she was lifting something, and it was very light, like a bag of sugar or something. It was not a heavy thing, so it obviously must have been a kind of cumulative build-up of something, and her back just went into spasm, and and we had a physiotherapist come out, and he said, look, this the back spasm is going into spasm is actually a protective mechanism, so
Right.
that you don't create any more problems for yourself. What would Bowen offer to someone like that, someone that's gone into this kind of acute spasm phase, and their legs are sort of not, they can't stand straight, can't walk straight? Would Bowen be able to help someone like that?
Yeah, so bones, generally in my experience, quite strong in that area. So the body's gone into its sense that there's a potential for damage, so it's locked itself down and it's playing the pain tune, just as people put like red cones and cordon off an area, your body does that as well. It senses the lower back's in threat. It
Yes.
cordons it off by locking on the back muscles or tensing the hip flexors, and if anyone goes near anywhere that the body thinks that there's potential for more damage, you'll get a pain spasm. So it's all defensive. So Bowen is fantastic, I find, with this because by doing these gentle moves, it helps to sort of encourage the body to relax. So you don't want to do anything heavy or jarring at this stage because it could make the spasm worse.
Mm.
But with gentle, relaxing moves, quite often, I'd say with an acute back spasm,
Hmm.
I'd say 90% of time I'll see a significant difference in someone's back pain on the first treatment.
Wow.
So that could mean that they're sort of like maybe 60% less pain, more mobility, maybe they're walking a bit better, they're standing a bit straighter. It's still going to take time, it's not like I'm just going to make that disappear,
Yeah.
but it helps to sort of relax out the spasm, I think.
Mm.
And people often think, I've fixed them,
Hmm.
but it's more that I've helped to, I've helped the body relax, but then it's the body that's decided to release and let go
Hmm.
and go, oh, actually, maybe things aren't as bad as I thought. And then the body just kind of
Yeah.
lets things off. If the times when that won't work will be if there's another factor, like there is damage,
Hmm.
say there's a bulging disc.
Yes.
There's something else that is like a real injury, like a tear or something,
Mm.
then it's not that's not just going to clear up. That's going to take time. Bone will
Yeah.
help to rebalance the body to help it to heal.
Yes.
But if it's a classic spasm, as if someone just jerks a certain way or moved a certain way and it just caught the body off guard and it went into a lockdown, most of the time it'll just clear fairly soon with Bowen.
Yeah. Yeah. That's really insightful. Thank you, Roland. Are these services, Bowen? I mean, can you get it on the NHS, Bowen? Is it available to people, um, through their GP or through the health service, or is it only in the private sector that you get Bowen therapy?
It's only in the private. It is recognised by the NHS, like a fully qualified. If you're registered with the Bowen Therapy Professional Association as a qualified Bowen therapist, you can register with a complementary National Healthcare Council who are recognised by the NHS. So it is seen as something that is recognised. I remember a good few years ago there were Bowen therapists working with physiotherapists in an NHS setting,
Mm-hmm.
somewhere up in the northeast, and
Right.
it was a pain clinic. So because they've seen that Bowen, a few treatments of Bowen can really help to reduce people who are on chronic pain medication, the amount of pain medication that they're taking. We don't really know the mechanism of effect or quite how it does that,
Yeah.
but we can see from what people report that they're seeing a reduction in the amount of painkillers they need. That's something I see in my own practice regularly.
Mm.
People are just not needing to take so many painkillers.
Yeah. Yeah. And there are so many, when you're taking analgesics, that sometimes there are side effects and, digestive and, in terms of toileting and other things that, people experience. So it's nice to have a more natural remedy. And if something else can help and you can come, yeah, I don't know anybody that wouldn't like to take less painkillers. So,
Yes, of course.
it's a good one. And in terms of the parts of the body or the sorts of ailments Bowen therapy can help with, we're talking about back, but what about things like neck and limbs and, other parts of the body? Does Bowen therapy help all parts of the body? And are there
So I'd
particular
say,
conditions it's really good for that you, in your experience?
sure. Where I find it's really strong
Mm.
is helping the body to adjust its tension and its balance.
Right.
That's where it's really strong.
Mhm.
So, if the one shoulder's higher than the other, or someone's got rounded shoulders, or their posture's out, or their jaw's out, or their pelvis is tilted the wrong way,
Yes.
um, balance, it help the body can just start to readjust its tension quite quickly when you have bone. Um, so balancing the body is a big part of it, and the way the body is stacked is very good. And
Mhm.
then by balancing the body, there's certain conditions that are quite, it has that quite has a strong effect in helping. So
Mhm.
it could be maybe back pain, neck pain, shoulder pain, because the body's out of balance will often feel a lot better. Frozen shoulders, it's very strong with, restrictions in the movement of the tissue.
Right.
Um, Migraines quite strong with, so people have regular headaches, tension headaches around the jaw pain, TMJ problems.
What's
Um,
TMJ?
TMJ, temporomandibular joint. So it's this the jaw joint here that opens and closes.
Okay.
Coccyx pain, it's very
Uh-huh.
good with.
Mm.
People have fallen on their coccyx and it's knocked it out slightly. Then Bowen can just help the body to recorrect itself.
Mhm.
Um, Sleep issues, when the body's more relaxed and more balanced, it'll regulate itself better, you'll sleep better.
Yeah. So
And then maybe with anxiety as well, if people are feeling quite highly tense, it's not going to solve their worldly problems, but it'll just help take the body into a more relaxed state, which can help them on their journey with whatever other work that they're doing as well.
so the emotional comes back there and but also sleep and things like that. What do people report after initial bone therapy? Are there any sort of side effects or I know you said that people might sort of connect with more emotional aspects of pain, but do they go away with a sort of sense of any more soreness or stiffness or uh,
So
uh,
yeah, definitely. So it can be quite radical, especially the first Bowen treatment.
mhm,
Say if the body's got used to being, in a certain position, even though it's off position, the body's got used to it.
mhm,
So all the muscles and everything have got used to working in that way, even though it's imbalanced, it's become familiar.
mhm,
So if that's been for quite a while, then what happens is when the body goes to reset itself into a new position,
yeah,
you could imagine in a way it's moving house, right? Into a new setup. So some of those muscles that weren't working at 100%, maybe they were working at 50%, now
yes,
are working where they should be working, and they're not going to like it at first. So actually, the body can ache. They could be aching a bit like you've been to the gym.
uh-huh, uh-huh,
Quite commonly with Bowen, sometimes there can be an initial feeling of like a natural opioid effect of feeling relaxed and lovely, and that's so nice, so lovely.
yeah,
And
yeah,
then the following 3 days, there can be sometimes some aching. Sometimes people get hot and cold sweats when the body's changing. It could be emotional releases. So
okay,
it's always really important that I let people know that
yeah,
the natural healing process is not necessarily going to be all floaty and comfortable. It's going to take some work, and
yes,
people can sometimes feel very tired. They need to rest a bit more.
mm,
And also, like if someone's had a very stressful life, a very busy job, and they've got a lot on, and they want to relax and rebalance,
mhm,
you need space to do that. You can't just sort of come
yeah,
firing in from a busy job, have a Bowen treatment, and then fire back into a busy job and then just crack on. I
mm,
always say to people, if you have Bowen, try to make some space afterwards to allow the body time to do its adjustment, to find its new groove,
yeah,
everything to all the muscles to get used to their new position, and then, come back into whatever you're doing.
no,
I know it's hard to do that in the modern world. People have children, busy jobs, but it's
sure.
important that I make them aware of that's a possibility.
Well, it starts to open up this sort of thinking, doesn't it? And what other adjustments are needed
Yeah,
in life, and it may be hard to sort of employ those changes or bring them about, but at least there's an awareness and moving towards it.
yeah.
So with the kind of way in which the body heals for a period after a Bowen treatment, is that what sets it apart from more traditional massage, would you say,
I
Roland?
think it's different in a way. I mean, normally with a normal massage, it's that you have a continuous contact throughout the treatment.
Yeah.
Um, with Bowen, there's a few very specific moves are made on the
Mhm.
body and then pauses.
Right.
Usually the pauses are a couple of minutes to allow the body to respond because the body
Mhm.
does the responding itself. With some deeper procedures with Bowen, there could be a 15-minute break. There's
Wow.
like some of the deep coccyx, or when I say deep, not with pressure, but ones that actually allow quite a deep space for the body to adjust. They can be up to 15 minutes gaps sometimes.
Okay.
So they are
And
quite
yeah,
different.
so and can it be used with any age group? I mean, could
Yes,
children use benefit as well as sort of adults, older adults, and so on?
absolutely. Yeah, I treated a little 3-week-old baby last week. Just, the mother just felt that
Yeah.
a bit stressed and there was a difficult birth, and she felt like it would just be good for the baby to have like a little bit of a gentle rebalancing.
Wow, that's
Um,
amazing. So even a baby.
yeah, yeah. I just have to use my little finger. Like,
Yeah, yeah, yeah.
I don't do the Bowen rolling move. I just
You did little bits, yeah, yeah.
little bits here and there.
So how many, I mean, obviously it depends, I guess, on the ailment and the history, but what's a sort of average, number of sessions? What would be the minimum or the maximum? Can it go on for a long time? Is it generally quite short and brief? What's your experience and advice around?
You so usually one of the good things with Bowen is that you don't really need to have a lot. Sometimes with other chiropractic, sometimes it's 3 a week or 10, 20 sessions and things like that, most commonly here. With Bowen, you really only need like 2 or 3 sessions normally. And
Okay.
then, but by that time, your body would have corrected itself as much as it can.
Uh-huh.
Um, Massage and things you could have weekly or more regularly just to boost circulation and that kind of thing is fine.
Yeah.
That you usually find with Bowen like 2 or 3, and that's it.
I see.
Then I'd recommend people come back every sort of 6 weeks, couple of months, because it's always good to have maintenance, just like you maintain a car.
Yeah.
The body can shift out of balance. So even when you feel okay, it's good to just come in and have a service,
Have a
and
rebalance. Yeah.
because you can. Most people will find they come in feeling okay and they walk out feeling even better,
Yeah.
more
Yeah.
balanced and more integrated. A common thing that people report when they have bone is that they just feel more balanced. There's
Hmm.
not like one part of the body that's sticking out more than others. There's just a sense of it feeling all more integrated and together.
It's wonderful. And Roland, in terms of costs, because it's a private undertaking, isn't it? People would need to find some money to pay for the sessions. Some easier for some as compared to others, I suppose. But what are we talking in terms of what people might expect to spend on bone therapy with yourself? Is that
Sure.
something you
So,
could talk about?
yeah, sure. So a first session with me normally costs £60.
Yeah.
And then that will include like an assessment, so the consultation as well as the treatment. Treatment might last maybe 30 to 40 minutes. So your first one might be a little bit longer, maybe about an hour and a quarter.
Hmm.
Uh, and then the follow-up treatments are 50, and they might last around 40-minute treatment and then a little bit of a wrap-up time together as well.
Okay. Yeah. And the kind of follow-ups at 2 to 3 month intervals would fall in that follow-up category.
Yes.
Yeah. Okay. And if we're looking at sort of 2 to 3 sessions, it's a fairly contained amount of money for some good change, hopefully, for people. Uh,
Absolutely. I mean, the thing is, if you
yeah.
if you think about it, if your body is out of alignment
Mm.
and it stays out of alignment for years, your joints won't last as long. Like your back will get worn out quicker, neck vertebrae will get worn out quicker.
Mhm.
As if the bricks are stacked evenly on top of each other, the force is spread evenly. But if things are, like that, then the edges wear away much faster. So it's good just to have a few sessions of Bowen just to true your body up best that it can be, really.
And it's a
Yeah, I
lovely
mean,
with the bricks and the alignment and where the kind of
yeah,
pressures and weight bearing
yeah,
happening. Yeah, it's wonderful. Is there anything else as we close up for today, Roland? Anything that I've not asked you about Bowen therapy that you wanted to share or talk about?
sure. I think some useful things to know is that Bowen can be done through loose light clothing as well, so people don't have to undress.
Uh,
Uh, so if people, it makes it a bit more accessible in a way. There's no sharp jerking, cracking, or any of that kind of movements within Bowen as well. Um,
no oils, I'm assuming, because it's not that kind of a treatment, is it? Mm.
no oils,
No.
no, and also because I've got a background in exercise, I can always give people a few exercises or recommend some stretches and different things they can do. I can do assessments where I can test, look at their flexibility, analyze their body a little bit, so I can point out areas that they might be able to improve as well
Mhm.
as part of the treatment. So I can sort of recruit all of that together.
It's great. And in terms of when you offer the sessions, Roland, do you do sort of evenings, daytimes, weekends? What's
Yeah. Usually I try to work mainly Monday, Wednesday, Fridays, and some Saturday mornings.
okay, lovely. Well, thank you, Roland. It's been a real pleasure talking to you. I've learned some things about Bowen therapy. I didn't know too much about it, but I think anyone that's looking for some pain relief or some rebalancing of the body or just longevity in their health and well-being, perhaps they're struggling with sleep or other kinds of pressure and stress. sounds like Bowen Therapy is a very helpful approach to try and experience. So I'm really glad, Roland, that you're offering those services here at Solihull Wellbeing Clinic, and I strongly encourage people to get in touch. And I suppose, Roland, you'd have an initial call with people just to
Yeah,
a phone conversation just to sort of see if it's for them. Uh,
absolutely. Yeah, I like to sort of triage things. I think that's really important because sometimes things can happen where I treat one person, it's a miracle for them, and they tell everybody, and everyone just floods in and wants the same thing, and I have to speak to them first and say, okay, well, what is it you want working on? And
yeah,
I can't predict the future, but I've done it long enough to kind of get a gist of what it's strong with and which of the conditions might be more challenging. So I can kind of manage expectations that way and say, yeah, this is a good chance it'll help you. I'm not sure on this case, but you're welcome to give it a try, just so people are clear before they take that step to come in for treatment. So yes, I'd speak to them first. Yeah.
good, good. Well, Roland, thank you very much for your time, and I'm sure the
Thank
listeners
you.
enjoy listening to this. And we'll speak again soon, hopefully.
Thanks so much, Dr. Bobby. Thanks for having me.
Bye bye now. Thank you.
Bye.
So that was Roland sharing his insights into Bowen therapy. I'm sure as listeners, you will have gained a lot of insight. And if you'd like to book in with a session, just email info@solihullwellbeingclinic.com, or you can telephone us on 0121 777 1675. Thanks again. And if you liked us, like us on YouTube and Facebook, or whichever platform you're watching on. And also don't forget to follow us, because there are a whole bunch of other videos on well-being, guided meditation, exercises, mindfulness experiences that are totally free if you are. Just tune into our channels. Thank you very much. Bye bye.